In this video, we are going to discuss the difference between radiating pain and referred pain. And I'm going to give you some examples of each that may surprise you. And if you're dealing with pain, they may help you figure out where your pain is coming from and how to manage it. Hi, I'm Dr. Clay Sankey, chiropractor and owner at TruMotion Therapy here in Charlotte, where we specialize in the conservative management that is without drugs or surgery of musculoskeletal pain and injuries. In clinic, we deal with radiating and referred pain on a daily basis, and that is pain that is felt distant from the actual source of the pain. And that's pretty much where the similarity between radiating and referred pain ends. We're going to get into what those differences are. So radiating pain can be thought of as nerve pain. It's pain that is felt along the course of a nerve. Now, all the nerves in our body start in our brain, and just about all the nerves in our body travel down the spinal cord and out into our extremities. And we can experience radiating pain pretty much anywhere along the course of that nerve. And if there's an issue somewhere along the course of the nerve, it can cause radiating pain. Now, one of the more common examples of radiating pain is sciatica. So sciatica is an irritation of the sciatic nerve. The sciatic nerve starts in the lower back and goes down the back of the hip, the back of the thigh, and then behind the knee it branches off into some other nerves and goes down into the lower leg. Now, irritation of that nerve can cause pain along its course. Now, with radiating pain, we don't necessarily feel pain along the whole course of the nerve. In fact, that's kind of rare. We typically feel it in pieces. So oftentimes people with sciatica will only have pain in the back of the thigh. They will not have pain in the lower back where the actual source of the pain is. They can also have pain in the hip, but not in the thigh or the lower back, and so on and so forth. Radiating pain is typically felt like an electric shock or a sharp pain, and again, it's along the course of that nerve. Now, referred pain, for our purposes, is coming from muscles or joints. Oftentimes, a little section of a muscle can become very, very tight for a long period of time, and we call that a trigger point. Now, trigger points can cause pain locally where they are, or they can cause referred pain as well. One of the more common trigger points that we see in the body is in the upper trapezius muscle right here. So we'll get a taut band of muscle tissue in the upper trapezius muscle, and it will cause referred pain into the back of the skull, the temporal region, and or the corner of the mandible here. Now, this can mimic headaches. It can mimic TMJ syndrome, and oftentimes people get misdiagnosed with migraines or TMJ syndrome when actually they really just have a trigger point in the upper trapezius muscle. Another common example is a trigger point in the medial head of the gastroc muscle in the calf that will cause referred pain to the bottom of the heel, mimicking plantar fasciitis. We'll also see referred pain from the joints as well. These are usually the spinal facet joints. When irritated, they'll cause referred pain. This can cause referred pain down the thigh, into the arm and shoulder, or into the flank as well. And again, these can be misdiagnosed as nerve-related pains when actually they're just caused by pain from the actual spinal joints themselves. Referred pain is usually sore or dull or achy in nature. Rarely is it really sharp or electric like radiating pain. Now, fortunately, the vast majority of cases of radiating pain and referred pain can be managed conservatively. They don't need advanced interventions or advanced imaging to diagnose or treat them. So if you're dealing with stubborn pain that you can just not get to the bottom of, we would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or to book an appointment.